If you're joining us this evening, it's likely because you or someone you know, like your child or the students that you work with, are interested in pursuing a career as a nurse practitioner. You might be wondering what the role looks like day to day, what the education pathway involves, and what it's like to practice in a rural setting. I'm honored to introduce our speaker who is here to help answer those questions and share their experience with you. Linda Wonitoway-Raw, nurse practitioner. Linda graduated from the University of Alberta's Family and All Ages Master's Nurse Practitioner stream in 2009 and has since built extensive experience in primary care, women's health, and mental health and addictions. She practiced at West Grove Medical as a contractor with the Westview Primary Care Network and assisted in the development of the Westview Women's Health Clinic in 2008, where she continues to provide services with the Westview PCN. She was the primary care provider for community members at the Alexis Nakota Sioux First Nations from 2011 to 2025. She now practices in downtown Edmonton part-time and teaches at the University of Alberta in the Faculty of Nursing, Nurse Practitioner Master's Program. She continues to participate in various Westview Primary Care Network working groups and gains insight into provincial delivery of primary care to Albertans during this time of transition. She has a passion for women's health and mental health and addictions, and she has participated in developing guidelines for substance use disorders and completed advanced training in addictions care. She has a strong knowledge of contract negotiations and mentoring new nurse practitioners into primary care practice. Her advocacy includes engaging nurse practitioner NPs, MLAs, and policy advisors to advance nurse practitioner practice, improve access to addiction services, and reduce barriers for vulnerable patients. She has partnered with Indigenous communities and provincial stakeholders to reduce barriers for primary care and addictions care access. As Director of Rural Primary Care with the Nurse Practitioner Association of Alberta, also known as the NPAA, Linda brings a strong commitment to equity in rural healthcare access and services in advancing the role of nurse practitioners in Alberta's healthcare system. Thank you, Linda, for joining us this evening. I'll now turn it over to you.
Great, thanks. Thanks so much, Emily, for that nice introduction. So, welcome everyone. Like Emily said, my name is Linda Wonitoway-Raw. I'm a family all ages nurse practitioner. I've been a nurse practitioner in Alberta for almost 18 years, and I took my undergraduate nursing BSCM program at what used to be called Red Deer College. I think it's now called Red Deer Polytech. This institution offers a collaborative nursing degree program, and I graduated with my BSCN in 1997. So I'm telling you this just because it kind of leads to why I became an NP. As an RN, I worked in various positions, acute care, ERs, labor and delivery, and home care and public health. My focus as an RN was always on preventative medicine, and that's what drew me to want to become a nurse practitioner. So I applied to the Master's Nursing Program at the University of Alberta, the NP Family All Ages stream, and graduated in 2009, 8, 9, somewhere around there. And then being an NP allows me to deliver evidence-based medical care to patients. And because I'm a nurse, I also have years of experience understanding the holistic approach to delivering care. As an NP, I've worked in primary care, including working in a medical clinic seeing patients of all ages, a women's clinic focused on all issues being female. I've had my own practice at a First Nations community for 14 years delivering primary care with a special interest in treatment for mental health and addictions. And I currently work in downtown Edmonton 2 days a week in a primary care clinic focused on delivering care to vulnerable patients. And I teach at the University of Alberta in a master's program. I also work part-time in a youth clinic that's new in Spruce Grove, Alberta, and for Recovery Alberta in corrections, delivering primary care. Nurse practitioners are registered nurses that have advanced education and training. Nurse practitioners have attended accredited universities to meet entry to practice standards that are upheld by our regulators, and we have achieved all regulatory standards in order to practice within our specialty. Nurse practitioners also complete continuing medical education credits alongside physicians to increase competency and skill sets. This slide is taken from the Nurse Practitioner Association of Canada, NPAC, and displays the distribution of nurse practitioners across Canada in early 2025. NPs are currently the fastest growing field of healthcare providers in the country. So, educational requirements. You have to be a registered nurse to become an NP. There are many accredited educational institutions across the country and in the US that support master's NP programs. Admission requirements include you must have a current active registered nurse RN license from your regulatory body, 4,500 to 5,000 hours of current RN practice. So that's about 5 years of full-time work. And academic requirements usually include a previous GPA of about 3.0 from your undergrad BSCN program. A graduate degree takes 2 years to complete full-time. I did my graduate studies over 3 years because I had very young children at the time, and it worked better for my family to do this. There's a lot of flexibility in the program, and that's really helpful for situations like that, especially when most nursing and nurses are NPs are still it's a female dominant position profession. So, as I stated in the previous slide, there are many universities across Canada and in the US that offer the Master's Nurse Practitioner program. Since COVID, many of these universities have altered the course delivery and most offer a hybrid style of education. And this is extremely beneficial to many RNs who live in rural communities, as the virtual stream allows students to learn most of the course material and complete the academic course assignments from home. However, all programs require an on-campus hands-on learning portion. The hands-on learning is mostly focused on learning advanced clinical assessments and advanced skills and procedures. All NPs must complete practicum hours within their area of practice. In my teaching position, I currently have students who are enrolled in the NP Family All Ages stream from across Canada, learning from experienced NPs or physicians for their practicum placements. I'm referring to this slide again because it reflects the recent numbers of NPs across Canada, but it also shows that there are 34 nursing programs in Canada at the graduate level. Most require a minimum of 6 years of healthcare education. 4 years to get your BSCN degree, plus 2 years for your master's degree. So just to clarify, first you become an RN who has 4 years of schooling, which is 4 years of schooling, sorry, then work a minimum 5 years to get your 4,500 to 5,000 hours of experience. Then you take your master's program, which is 2 years. So the NP education in Alberta. This is a little busy slide. You guys can focus on it, but currently there are two options to get a master's degree within the province of Alberta to become an NP. A majority of NPs in Alberta have received their degrees from either of these two universities, the University of Alberta or Athabasca University. That does not mean that there are not NPs in Alberta who have taken their NP degree from a different university or another province. Remember, I mentioned that there are 34 accredited programs in Canada. So you can live in Alberta and take an NP program from any university, any accredited facility across Canada. And I have preceptored students from a number of different programs in Canada and worked with dozens of NPs who have been trained in different provinces or even in the US. The amazing thing about becoming an NP is that you have skills that can take you anywhere to practice. So, what is the difference between an NP and a doctor? This is a question that NPs get all the time, every day. I also get called Dr. Linda, or patients will say to me, "You're my doctor," to which all NPs will reply, "We are not doctors." The main difference between doctors and NPs is the pathway of education and experience that gets us to the same place, which is providing advanced clinical care to patients. I deeply respect my physician colleagues and respect the pathway that they have endured to become doctors. So again, let me repeat, I am not a doctor. So besides the obvious different educational pathways, the main difference between NPs and MDs is our underlying philosophical approach to patient care. Doctors and NPs come from different foundations in that NPs are grounded in a theory of nursing. Becoming an NP requires RNs to transition into the role of expert clinical diagnostician. The similarity between NPs and MDs is that by the time an NP or MD enters practice, That new professional must meet clinical competencies regulated by their professional regulatory body. NPs are regulated by the College of Registered Nurses of Alberta, CARNA, to provide services designated under the Health Professionals Act, just like doctors who are regulated by the College of Physicians and Surgeons of Alberta, the CPSA, and are regulated under the Health Professions Act. These services in areas of practice are the same. With the cost of healthcare increasing in Alberta, with the cost of healthcare increasing and Alberta having the highest rate of fee-for-service funding for physicians and a growing population, this cost is only expected to increase. MPs have a fiscally responsible solution to lowering healthcare costs in Alberta, as the funding model to provide care is different. As well, because the funding models are different, we are able to focus on quality of patient care and not quantity of patients seen. I will make note, though, that recently the government of Alberta recently settled a new primary care physician funding model that is trying to get away from fee-for-service to a salary type model, to hopefully rein in the cost of healthcare. It's really complicated, and I'll just leave it at that. This slide is small, and I apologize for that. I couldn't make it any bigger, but it highlights the similar roles, tasks, skills, etc., that nurse practitioners and family doctors have. But again, I want to highlight that NPs are not physician replacements. We have a similar scope of practice. Many people are still confused about this, but there is a push to start changing the language to primary care provider or PCP to help everyone understand that not everyone needs a family doctor, but everybody needs either a family doctor or nurse practitioner. Why are NPs needed? Decreasing number of physicians matching to family medicine. Most people who get admitted into med school go on to specialty practice. There's difficult barriers to recruiting doctors from other countries, a slow rate of growth of the profession of MDs at 9%. Many physicians are retiring or leaving the province, and patient complexity is growing as our population ages. More complicated mental health issues and a growing Alberta are all reasons why relying on just one profession to fix the access to primary care is not sustainable. Nurse practitioners are the only other regulated healthcare professional that can increase access to primary care services. So why choose to become a nurse practitioner? I can tell you why I chose to become a nurse practitioner. So basically, I liked being an RN, but the scope of practice at the RN level was not the level of responsibility I desired. I wanted to increase my medical knowledge. I wanted to practice independently and autonomously. Um, what is a day in the life like for me at work? It really starts like any other professional, like a physician. Your day starts with reviewing your inbox, which contains your labs, your results, previously ordered imaging, replying to various messages. Then you see patients all morning and afternoon, usually little or no breaks. At lunch, and at the end of the day, you review another set of new items in your inbox, referrals that are waiting for you to review, and sending other consults if needed, making sure that all your prescriptions are done by the end of the day. And what is the differences between your role in a general practice and other professionals? So my role is that I'm the main primary care provider, and I delegate tasks to other staff. Um, so it's just like being the physician in the office. You're doing the clinical work and you're delegating everything else to the team that can help you. What's the great thing about working in rural Alberta? NPs come from a variety of nursing backgrounds. Some NPs will stay in the acute care setting and work in hospitals. Some hospitals have NPs that work as generalists in rural areas that oversee the acute care of admitted patients and manage day-to-day care of patients. NPs in acute settings work in a team-based model and consult physicians as needed. Many NPs work in outpatient clinics in specialty areas such as neurology clinics, pediatric clinics, heart function clinics. There are literally dozens of different specialty areas of practice, just like there are physician specialties. I'm a family all ages NP, which means I work in primary care. I work daily seeing patients in a medical practice and delivering care like GPs do. Many MPs work in rural communities and provide access to primary care services to rural communities as there are not enough family doctors to see all Albertans who require that care. I have always worked in a rural setting and I loved it. When I was an RN, I only worked in rural areas. I never worked in a big hospital or a tertiary care facility in an urban center. I decided to work in rural areas because I could never decide or to specialize in one area. Being a generalist allows me to help all my patients. I see patients of all ages. Primary care provides, we like to say, from cradle to grave or from prenatal to palliative care. Patients need access to primary care providers and appreciate not having to leave their own community to see their primary care provider about their health issues. Accessing your primary care provider when you are experiencing the issue is vital. So not having to travel or wait months to see them is why more rural primary care providers are needed. Some challenges to consider being an NP in primary care in a rural setting is getting used to working alone geographically sometimes, but also understanding there is always access to expert help if you need it. Creating a great primary care team in rural areas is the goal of MPs and GPs as Alberta struggles to meet the healthcare demands of Albertans. So, NP career diversity. What do I love most about my job? I love building rapport with patients and providing care over the continuum of the health and illness that is primary care. My goal is to keep people healthy. That really is what I love. The Bachelor of Nursing was an in-person program, and I enjoyed learning in a team-based approach. But this post-secondary, my I was lucky in the sense that I graduated many years ago, and my nurse practitioner program was very little hybrid, mostly in classroom. I completed it just before the internet and virtual meetings exploded. I teach now, and I would have to say that the hybrid virtual model of delivery is super convenient. And I think, as I'm talking to a bunch of high school students here, this is what you guys are really good at. It's just so easy for all of you. And it's not even, you don't even kind of blink an eye thinking that you'll have a hybrid or a virtual class delivered to you. And it's really great for allowing RNs from all over Alberta to become NPs and then go back and work in their own communities if that's what they want. And that's what we hope is what they would want to do. The virtual model is super convenient and allows for more flexibility and access for learners all over the province. But it's a balance, ensuring that there's enough classroom engagement. Most NP programs require 800 hours of clinical placement hours to ensure competency. And then what have you learned as an NP that NP training didn't teach me? People's ability to change their behaviors and understand their emotional response to their behaviors is vital. So I think as an NP, if I could prescribe, I can't prescribe a pill to take to change your behavior because that's what patients have to do on their own. So that's the end of my presentation. I'll take questions now.
Thank you, Linda. We really appreciate the time that you took to be here with us this evening. I'm sure you've inspired a few students joining us to explore a career as a nurse practitioner. Um, I do have a couple of questions just as we wait for questions of the audience. What advice would you give to someone who's just starting to think about this career?
First, I would say is it you have to be a nurse, so that's important to understand. So if you're thinking about going into nursing, this is something that I hope all RNs would think about doing. It's not for everyone, that's for sure, but if you're leading towards healthcare, this is a growing field. When I when I started my career almost 20 years ago, people didn't know what nurse practitioners were. Nobody knew what we were. And now like I said, we're the fastest growing healthcare profession in Canada. And I get I probably get 2 or 3 job offers every week right now. We're very flexible. The wage is very good. It's more than an RN, and it's very portable. So you can work almost anywhere. There's a lot of, like anything with technology, there's a lot of flexibility now in the sense that even in a specialty area, you can deliver a lot of virtual care as well. So that also allows a really good work-life balance.
What are some good courses to take in high school to maybe give students a feel for what it's like down the road?
In order to get into nursing, you have to take, I believe you have to have your -1 courses. So just thinking about the prerequisite of being an RN, you have to sort of think that way along the lines. There is, um, in some bigger high schools, there's like a sports medicine option, and that's a really good anatomy and physiology type of class that gives you a little bit of background that you'll learn in nursing school. Um, Communications is really important. So if you are a good speaker as well, I think that's just something that, because you work a lot with the public, having some skill that way, but we're not expecting high school students to come out and be pros at, engaging in conversations with total strangers. That's the art of nursing. You develop that um, through your years of practice. And then the 5,000, the 4,500 to 5,000 hours of practice can be in any area of nursing. You don't have to be in primary care. You don't have to, it can be in mental health. It can be in any area of nursing. It can be in a bunch of different areas of nursing, depending on what you've decided to do. Um, so by the time you decide to go in to become an MP, you can have an idea of what area you might like to practice in.
Are there opportunities to specialize as a nurse practitioner? And then the second one is, what would the role of a nurse practitioner look like in an ER? So I think those two go kind of hand in hand.
Okay, yeah, those are great questions. So there are specialty areas. I'm in the family all ages stream. This is going to get a little bit technical, but next in 2027, the nurse practitioner education stream is it's just going to change a little bit. We're going to be having a generalist stream. So basically, that will be like a family doctor stream where you're going to learn everything. And then there is another specialized stream that is neonatal nurse practitioners. So they are very separate because they're highly specialized. When students graduate from the family all ages or the what we're going to be calling a generalist stream, they can go into areas that they have found to be um, that have that they have more of an interest in and then develop from there. So even a generalist can go into an emergency room and practice. There's going to be some certificates that you can take, just like a family doctor who graduates from medicine has to take uh, an extra 2 years to become a rural doctor, right? So we would have a certificate that you take to be a rural emergency NP and other courses. There's other things like we're getting more technology in the emergency room. So we call these things point of care ultrasounds. So you're getting trained on doing some bedside ultrasounds, these sorts of things, these sorts of skills, and they're always advancing. But like I said, we have a lot of already right now we have MPs that, again, I'm family all ages, so I'm like a family doctor, but we have nurse practitioners who work in acute care settings and they're highly specialized. Some will work in transplant, some will work in oncology, some work in pediatrics, some work in um, the renal units. They work in nephrology. They'll work in orthopedics. So even if that's something that you've really liked as an RN, and you're like, I'd really like to be an NP in this area, you can tailor your stream to be like that. And a lot of times, what we have found is RNs find the area that they like, they go back to school and become an NP, and then they kind of shift back into that area that they've been, but as a higher level of specialty. And so a lot of NPs will go back to the area that they started and they're now that nurse practitioner in that area where they were working as an RN before. And the government is looking and saying, this is a really good formula that you have here. We have people who are taking the load off of the specialists, especially in the acute care setting. So you have the specialists that are in big centers that can't see all the patients, and they need the subspecialists underneath them to be able to triage those patients and take care of them and really get those very few off to the specialist to be seen, or cut down on the number of maybe the frequencies that some of those patients need to be seen by that specialist. So that's where the NPs who are in those other specialized roles are fitting.
Does it matter where you do your hours as a practicing RN? Can you do them in another province or even as a travel nurse in another country and have them count towards the requirements for that master's program?
Yeah, you can. As when you become a registered nurse, you wherever you end up working. So if I was a registered nurse working in Saskatchewan and I wanted to move to Alberta, I would just have to apply for a license in Alberta, and all that work experience comes with me. So it's not like you have to start over in Alberta and get 4,500 or 5,000 hours in Alberta to apply to a program. So just like if I was working in Alberta, I could apply to the University of Toronto to take my NP program, and they would look at all my experience here. So it doesn't really matter where you practice. If you're coming from out of country as an RN, you would still have to apply to become an RN in Canada. There's a few stipulations about that. Basically, I think that just has to do with um, within the faculty of nursing, they look at that a little bit closer to see where you've graduated from and if those course requirements. Sometimes people have to just upgrade maybe a statistics course or an English course or something like that. Some nurses have to take a an English proficiency language um, class, just so there's that communication, but that's about it. And then once you're licensed as an RN and you have those requirements, you can apply to the master's program. And that happens, that's outside my area of expertise, but that does happen within the university.
What are some of the important differences for people deciding between a career as a nurse practitioner or a physician assistant?
That's a really great question. A physician assistant, I don't know a lot about the program, but I do know that you have to have a degree. And then, so you can have a degree in almost any field. And then your physician assistant program, I think, is a 2-year program. The main difference between a physician assistant and an NP, and they're both very vital additives to the healthcare system, but nurse practitioners can work autonomously, which means I can have my own practice and I don't have to report to somebody. As a physician assistant, you are always going to work under the auspice of a physician. And so sometimes so you're going to have to get your plan approved by a physician. You can't work independently.
Is there anything that you miss about being a nurse now that you're a nurse practitioner?
No, no, there isn't anything. I don't miss the shift work because that's a lot of what I did as an NP or a registered nurse. Um, nope, I don't think I would have stayed in nursing if I couldn't have been an NP. So it was a good transition for me. And really, what I said, it was the level of responsibility and the scope of my practice. So as an RN, I I always was thinking there's more to this. Like, why did the doctor order that? Why would you do that in that situation? Why? And when I worked in the emergency room, I was always seeing patients that were coming in who didn't have access to a primary care physician, or like we know, families, doctors are so busy that they don't have a lot of time to educate their patients. And I would always see patients and be like, geez, didn't your doctor tell you how to use this medication properly? Or geez, didn't, we could have prevented you coming into the emergency room. So that's what I love about being a nurse practitioner is I get to spend quality time with my patient to really make sure that they understand the management plan. Do you understand your illness? Do you understand the things that you can do to prevent flare-ups of a certain disease? Do you understand? And then if you're prescribing a new medication, do you know why you're taking this? Um, I truly believe that healthcare takes a team of people to provide care to patients. And as an NP, I really love being able to talk with my patients about that and make sure that they're understanding their illness, they're understanding the medications and the treatment plan. They have access, back to me very easily. So as an RN, I just didn't have that scope. I was always carrying out somebody else's orders, or I was putting out a fire and saying, go back and see your family doctor because you're not like you have COPD and you're not managing it very well. You need to get some education on this. So that's why I do what I do now.
What does the average yearly salary look like for a nurse practitioner?
That's a great question. So there's a couple of different funding models. But most nurse practitioners would probably make about, I'm going to say about 140 to $150,000 a year. That being said, the nurse practitioner primary care program. So again, this is getting a little bit technical. There's a new direct when you're in primary care. So working like in family all ages with people like a doctor does in their office. There's a new direct funding model back to the government, and we are funded about, I can't remember, 200, if you have a full-time panel, so you're working 5 days a week, it's about $250,000 they've given you to run your office. So hire staff, pay your lease, pay your bills, all of this operational cost. And when you trickle down out of that, it's about 150,000. We are going back to the government to say, that's not enough and we have need to have that increased because and the reason I say that is because Alberta was the first province to have this direct reimbursement model with the government of Alberta for nurse practitioners and family practice. Since then, BC, Saskatchewan, and Ontario have launched um, a similar model, and their pay is better in those provinces. So it gives us leverage to go back and say, okay, you know, Alberta's supposed to be the best. Let's get better wages back here. So that's just something again, we all as we start to become adults and deal with these sorts of issues, that's one of the that's a great question. The wage is more than an RN, but it still needs to be more because we should be almost equivalent to what that's what our goal is, almost equivalent to what family physicians are being paid because we do the exact same work.
Can nurse practitioners deliver babies?
We could. It's not in our scope in the sense that I would say if it was something that you really wanted to do, you could become a midwife. Midwives do a lot more deliveries than a nurse practitioner ever would. Now, that being said, there are nurse practitioners that work in the high risk antenatal. So before you have a baby, you go to, if you're very high risk, you would be seeing a specialty clinic. And so there are nurse practitioners who work with a lot of prenatal women and do the antenatal assessments. But as far as it is right now, nurse practitioners um, don't deliver babies, but midwives do. So again, you can become a midwife, and there's a very good midwifery program in the province of Alberta.
Thank you again, Linda. We really appreciate the time you took to present to everyone here.